Welcome to Evidence Mastery with Dr. Masoud Tusi. I am going to help you understand what systemic lupus erythematosus is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice.
All right, so today we're going to tackle a really complex and honestly an often misunderstood condition. Systemic lupus erythematosus. You'll hear it called SLE for short, or maybe just lupus.
So here's how we're going to break this down today. First up, we'll get a handle on what lupus actually is. Then we'll dive into the symptoms and signs, what it looks and feels like. After that, we'll cover the diagnostic process, then talk about treatment. And finally, we'll look at what it's like living with lupus long-term. Let's get started.
Okay, first things first. What is lupus? You know, a really good way to think about it is like a case of friendly fire happening inside the body. Your own defense system, the immune system, kind of gets its wires crossed and starts attacking, well, itself.
So, the more formal definition is that SLE is a chronic autoimmune disease. Now, what does autoimmune actually mean? Well, think about your immune system. Its job is to protect you, right? To fight off invaders like bacteria and viruses. But in an autoimmune disease like lupus, the system makes a mistake. It creates these things called autoantibodies, which, you guessed it, turn against the body's own healthy tissues. And this attack, this misguided assault, is what causes all the inflammation and can end up damaging different organs all over the body.
Now, one of the most striking things about lupus is who it affects, and the numbers here are really pretty staggering. The evidence from big population studies is clear. SLE is about 10 times more common in women than in men, and it usually shows up during their childbearing years.
And it's not just about gender. The risk isn't spread out evenly across the board. The evidence suggests that lupus is not only more common, but can also be more severe in patients of Black and Asian descent. Now, you might be asking, why? And the truth is, we don't know the exact cause. The thinking is that it's a combination of things. You have a genetic predisposition, and then some kind of environmental trigger sets it off. Oh, and one quick but important point. We have to be careful not to confuse this with drug-induced lupus. That's a whole different thing. It's temporary, caused by certain meds, and usually goes away when you stop taking them.
All right, let's move on and talk about what lupus actually looks like in a person. This is where it gets tricky because one of the biggest challenges with lupus is that it can show up in so many different ways. It truly is a disease with many, many faces.
So here's the key thing to understand. Lupus is a multi-system disease. That means it isn't just focused on one part of the body, it can affect, well, almost anything. And its course is like a roller coaster. There are periods where the disease activity ramps up, we call those flares, and then periods where things quiet down, which we call remission.
So what are the most common things we see? Well, way up at the top of the list are joints. We're talking about joint pain and arthritis affecting a huge number of patients, about 90%. Then there's the skin. You may have heard of the classic butterfly rash or malar rash that spreads across the cheeks and the bridge of the nose. Sensitivity to the sun is another big one. And of course, during those flares we talked about, it's really common to have symptoms like fever and absolutely crushing fatigue and just that general feeling of being really unwell.
But what's really important to remember is that lupus isn't just about the things you can see and feel on the outside. It can quietly affect your internal organs. For example, you can get inflammation of the linings around the lungs and the heart, which can cause chest pain. The kidneys are another major target. This is a big deal. We call it lupus nephritis, which is just a fancy term for kidney inflammation, and it can be very, very serious. On top of that, you can have neurologic issues and even problems with your blood, like anemia or low platelet counts.
So with all these different symptoms that can pop up all over the body, you can imagine that diagnosing lupus isn't straightforward. It's really like being a detective, trying to piece together a very complex puzzle. It takes a really careful, systematic approach to get it right.
So the big question is, how do you diagnose a condition that's such a master of disguise, one that can look like so many other things? The absolute key to remember is this. There is no single magic test for lupus. The diagnosis comes from putting together multiple pieces of evidence.
We can think of the diagnosis as resting on two main pillars. On one side, you have the clinical criteria. That's everything the patient is experiencing, their symptoms, what we find on a physical exam. And on the other side, you have the immunologic evidence. This comes from blood tests, where we're hunting for those specific autoantibodies that are the hallmarks of lupus.
Okay, a really key player in this diagnostic puzzle is a blood test called the ANA, or antinuclear antibody test. Now, this test is what we call highly sensitive. That means it's positive in more than 95% of people who actually have lupus. So if the test comes back negative, it makes lupus very, very unlikely. It's a great tool for ruling out the disease. But, and this is a big but, the test has low specificity. Think of it like a smoke detector that's a little too sensitive. You know, the kind that goes off every time you make toast? It tells you there might be smoke, but it doesn't tell you if there's a real fire. A positive ANA is just like that. It's a clue, not a confirmation. That's why it has to be followed up with more specific tests, which are more like carbon monoxide detectors. When those go off, you have a much stronger reason to believe there's a specific, real problem.
All right, so once we have a diagnosis, what's next? How do we manage lupus? Well, the most important principle here is that there is absolutely no one-size-fits-all recipe. Treatment has to be completely personalized for each individual.
Now, there is one medication that has become a real cornerstone of modern therapy, and that's hydroxychloroquine. The evidence for this is incredibly strong. In fact, major recommendations from 2019 state that this drug is indicated for pretty much every patient with lupus, no matter how severe their disease is. And why is that? Because we have solid data showing it reduces those painful flares and, most critically, it actually improves long-term survival.
So, that treatment strategy gets tailored directly to how active the disease is. Think of it in two main buckets. For mild to moderate disease, where it's mostly affecting the skin and joints, the goal is pretty straightforward. Control the symptoms and prevent flares. And we'll use things like hydroxychloroquine, NSAIDs, and maybe some low-dose corticosteroids. But for severe, organ-threatening disease, where the kidneys, heart, or brain are involved, the goals are much more aggressive. We need to induce remission and save that organ function. And that means bringing out the bigger guns. High-dose corticosteroids combined with much stronger immunosuppressants. These are powerful drugs designed to really dial back that overactive immune system.
So let's talk about the big picture, the long-term outlook. And I have some really good news here. Thanks to some huge advances in how we diagnose and treat lupus, the prognosis for people living with it today has improved just dramatically.
I mean, the outlook today is a world away from what it was just a few decades ago. Get this, in most high-resource countries, the 10-year survival rate for patients with lupus is now over 90%. That's an incredible improvement, and it's all thanks to diagnosing it earlier, having much better therapies, and just getting better at managing the disease and all its potential complications.
So what does successful long-term management look like? Well, it's really built on a few key pillars. First, it's about having a strong partnership with a rheumatologist for regular checkups. Second, it's about sticking to those foundational medications like hydroxychloroquine. Third, and this is a big one, lifestyle is huge. That means being really serious about sun protection to prevent flares. Beyond that, it's about managing cardiovascular risk factors. And for big life events like pregnancy, it means careful planning to time it for when the disease is quiet and in remission.
And to wrap things up, let's just take a quick look at the future, because it is incredibly exciting. We're seeing some amazing, promising results from brand new, cutting-edge treatments like CAR T-cell therapy for the toughest cases of autoimmune disease. And it really leaves you with this incredible question. Are we right on the edge of a whole new era in medicine? An era where we might actually be able to reset the immune system and truly get autoimmunity under control? It's an amazing thought.
I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.
If you would like to have a resource explaining diseases, medical conditions, therapies, and drugs in plain language, I am writing a book which will be published in 2027. Its title is Real-World Evidence, Diseases and Drugs. Stay tuned.